Now, joining us on News Across Nigeria today to discuss World Malaria Day is Dr. Abimbola Oshino. She's the manager, Lagos State Malaria Elimination Program. You're so welcome to News Across Nigeria.
Thank you very much.
Now, let's begin with the statistics, because they're rather surprising given the fact that this is an ancient disease as far as how long it's been on planet Earth for. But you've seen the stats of the malaria cases and the death rate. Why is the figure still on the high side, despite the interventions from the World Health Organization, from federal and state governments in Nigeria?
Okay, thank you very much. Okay, the figure is still on the high side because everybody at the moment has a part to play. When you're talking of malaria, malaria, as you all know, is passed on, is transmitted from the bites of infected female Anopheles mosquitoes. And once everyone does not realize that you have a part to play in terms of how these mosquitoes breed, then definitely over time, as interventions are being deployed, and the persons do not do what they are supposed to do, then definitely you would have increase in statistics.
How much innovation can we say we've achieved in Nigeria to reduce the malaria burden and save lives?
Well, if you look at innovations, it comes in different forms, in terms of investments, in terms of partnerships with organizations. I'll put it this way, we're work in progress. We are not there yet. And you can't even think of a single activity that can totally eliminate, but we have to think of new ways of ensuring that malaria is reduced in the country or totally even eliminated. And one way of doing that is ensuring that partnerships are put into consideration, and then activities such as expanding the use of the vaccines, because at the moment it started in 3 countries in Africa, Ghana, Kenya, and Malawi. So over time, I'm sure it would increase the number of countries that would be the vaccines would be deployed in would increase over time. So definitely, those are part of the activities and innovations that we're looking at.
Biologically speaking, this is the strength of Mother Nature. Never was there a hardy insect like this, like the mosquito. I think of the ants and how they prevail over generations. The mosquito is peculiar in this regard as well. Yes. And also, peculiar to me is the discovery of this vaccine, which many people haven't heard of. They call it the RTS. Yeah. How effective is it? Does it work?
Well, it's just started. It started late last year in those countries I just mentioned. So definitely for it to have, because it went through a series of protocols, series of pilots before it started deployment in those countries. So definitely, I'm sure over time we'd see, but we are hoping that particularly children under 5, between 6 months and 5 years, they're the ones that the vaccines are being used for at the moment to reduce their morbidity and mortality. And over time, I'm sure we'll see the gains. But for the time, it has actually been work in progress, and there has been a lot of encouragement with the vaccines.
Are they available in Lagos State?
We are not deployed in Nigeria at the moment. It's just those 3 countries that they are being used for now.
Okay, why those 3 countries?
Those were the pilot countries. It's a pilot program, so it started in those countries. And I'm sure with time, it will be expanded to others.
Now, what measures is the Lagos State government putting in place as well to help to reduce the burden? I know you've talked about the part that people have to play. Is Lagos State government doing something special, and what has been going on?
Well, when it comes to malaria, it's not just about the disease itself. There are so many other things that have to be considered. For instance, prevention. What are we doing in terms of prevention? Sleeping inside the nets. We actually deploy nets for our pregnant women and children under 5 in our health facilities. And our pregnant women as well. When they are pregnant, they're supposed to take intermittent preventive therapy, sulfadoxine pyrimethamine, which are given from 16 weeks. So those are given for free. Testing before treatment. Not every fever is malaria. We have to discover that. We have to understand that there are so many other causes of fever. For instance, we have typhoid, we have COVID-19. We have upper respiratory tract infections or even diarrhea and even stress. Those can come with symptoms like malaria. So it is important we test before we treat. And what is the state government doing? Our testing is free, particularly with the malaria rapid diagnostic test kits, which are given in the health facilities, and our antimalarials, the ACTs, artemisinin-based combination therapy, also given for free. We want to encourage everyone to understand that malaria cannot be defeated in isolation. We all have a part to play. What do I mean by that? Some of us may be breeding mosquitoes in our homes without realizing it. We have receptacles, we have containers that have water. and those are not, they are stagnant, and they are not covered. They are breeding sites. Some of our plants around the homes, herbal water, they are breeding sites. We have so many broken pots and pans around. They are breeding sites. Our gutters in front of our homes, when they are stagnant, they are breeding sites. So if everyone takes it, understand that you have a part to play to prevent malaria, prevent mosquitoes from breeding and malaria from spreading, then I guess very well that malaria will reduce significantly in the state.
You spoke of free testing for malaria. Where can that be?
At the facilities.
Accessed? And then we also hear, we've heard of free nets, mosquito nets given, but to whom?
Pregnant women and children under 5 who have completed their immunization schedule.
Specifically, because we also hear about underhanded practices where the nets that you have given to be free are being sold.
That happens. Is that true? Sometimes. But what we try to do is the nets that are given, as much as possible, we have not sold on them, not to be sold on them. And when we give them, we remove them from their packs, from their the nylon packs, so that they are not sold. So they are not eventually sold at any time, at any point in time.
What facilities are those given? The maternal health facilities? The
state public health facilities. So our primary health centers, secondary general hospitals, and the tertiary, that's LASUS.
What does LASUS and... Okay, fantastic. What advice would you give to people who are out there to, aside from these measures, which obviously if one follows, it will go a long way towards helping to prevent the disease, what other measures can one take to prevent oneself from getting malaria? Also, we know about the immune system. You hear people that say, oh, I get malaria once in a year. And then you hear people that say, oh, I don't get malaria at all, except I'm under stress, I'm stressed out, my immune system is low, therefore I'm susceptible to malaria. So what can people do really? How much of a role does nutrition and a healthy diet or healthy lifestyle play in this regard? Well,
the immune system really is important, but at the same time, as much as you boost your immune system with your diet, you also want to ensure that you are practicing preventive methods. So you are sleeping inside the nets at every point in time.
Finally, just jump in very quick because of time. Do you see the world meeting the 2030 target to eradicate malaria? Is that feasible? Is that a pie in the sky?
It's not a pie in the sky, because there's some countries that have eradicated malaria in their respective areas. As at 2020, were only 6 countries that had done that, and now we have 26 countries. So definitely, it's not a pie. It's not something impossible, but everybody has a part to play. It is not just a government's problem; it's everyone's problem. And until we begin to understand that, then definitely we'll get to our destination.
Thank you so much for your contributions to the program today. Dr. Abimbola Oshinawa, she is the manager, Lagos State Malaria Elimination Program.